Understanding retrograde ejaculation. In today's video, we'll discuss sexual activity, which typically involves an erection, climax, and then the release of semen. However, if the semen, instead of exiting forward, goes backward into the bladder through the urinary tract, this process is called retrograde ejaculation. This isn't a very common condition, but it can be a side effect or a consequence of various medications, surgeries, and diseases. Let's discuss this in detail today. How normal ejaculation works first. We need to understand how this process normally occurs in the body. As you can see in this diagram, our bladder has an opening called the internal sphincter. During ejaculation, semen exits through the ejaculatory duct. Normally, it finds the shortest path, which is towards the bladder. However, the system is designed so that when ejaculation occurs, the nerves responsible for ejaculation also close the bladder's opening. This prevents semen from entering the bladder, and it then exits forward through the urethra. This is called antegrade ejaculation or normal ejaculation. Symptoms of retrograde ejaculation for patients with retrograde ejaculation. It feels like they've ejaculated, but nothing comes out. Then, when they urinate, sometimes semen threads appear in their urine, which makes them realize that semen has mixed with their urine. Common symptoms include, "Sir, we have sex, but no semen comes out." Or, "Sir, very little semen comes out, and a lot of semen comes out with urine." Many people don't even realize it's coming out with urine and just say, "Sir, very little semen comes out," or "Semen doesn't come out properly." Then, the journey begins to figure out if ejaculation and orgasm even occurred, and if they did, why the semen is going backward instead of forward. Diagnosing retrograde ejaculation, the simplest test to understand this is to provide a urine sample to a laboratory after ejaculation. The sample is then centrifuged, and it's checked for sperm. If sperm are found in the urine sample by the technician, we understand that the patient's problem is retrograde ejaculation. Causes of retrograde ejaculation. Retrograde ejaculation is actually common in several conditions, congenital conditions. This can happen due to childhood diseases where the nerves we discussed don't form properly, or there's a defect in the spinal cord, spina bifida, or other structural defects. In these patients, due to improperly formed nerves, other deficiencies, or muscles not functioning properly, ejaculation doesn't occur correctly, and often the semen goes back into the bladder. Nerve damage, injuries to the lower back, nerve damage, or nerve diseases like transverse myelitis, viral infection, or other causes leading to nerve damage, or accidents where you fall and injure yourself, or problems like disc issues that compress nerves, can also lead to retrograde ejaculation. Neurological conditions and surgeries. Many neurological conditions and urological surgeries, such as prostate surgery or bladder neck surgery, can also cause semen not to come out forward and instead go back into the bladder. Then exiting with urine. Medications. Another important cause of retrograde ejaculation is medication. Many patients take medications for prostate or urinary issues, and the most common of these are alpha blockers. A significant number of patients experience retrograde ejaculation when taking alpha blockers. Specifically, if they are taking silidocin, almost 100% of people experience retrograde ejaculation. If they are taking tamsulosin, a smaller percentage experience it. The lowest rate of retrograde ejaculation is seen in patients taking alfuzosin. This is why, for young and sexually active patients, we usually prefer alfuzosin. Even with tamsulosin, the risk isn't very high, but we inform them that if this happens, they shouldn't worry. The purpose of today's video is also to make such patients aware that if retrograde ejaculation occurs due to medication, it is reversible, and normal ejaculation is usually restored after stopping the medication. However, if you have nerve problems, an injury, congenital issues, or diabetes causing nerve damage, these conditions are not easily reversible. Addressing infertility and retrograde ejaculation. So what can be done? The biggest challenge here is that if semen doesn't come out, how can a baby be conceived? In such cases, the patient is asked to ejaculate, and then the urine is collected. After some preparation, we provide some solutions, such as alkalizing syrups. We collect the sperm with these. We can retrieve live sperm and use assisted reproductive techniques to conceive a baby. So it's not that people with retrograde ejaculation cannot have a baby. Sometimes, if we cannot retrieve live sperm this way, sperm can be directly extracted from the testes using procedures like tease or other methods. And then they can be combined with an egg through IVF to create a baby. I hope this video will benefit patients who have problems with retrograde ejaculation. Those taking prostate medication and experiencing this issue will find some reassurance that it's not a major side effect.